Hello, thank you, Siham, for interviewing me. I'm Dr. Sarah Nahhal. I'm an infectious disease specialist.
Okay, so we're going to have a few questions regarding HIV. It's just 10 questions, very concise. If you'd like to get started now.
Yes, please.
Okay, so the first question is, what is HIV and how does it affect the body?
Okay, so HIV is the abbreviation of human immunodeficiency virus. It's a virus that can infect our immune cells, mainly the T cells, the CD4 cells. And once we are infected, we can have immunodeficiency and we can start having a lot of type of infections that affect our body until we can develop AIDS. AIDS is the acquired immunodeficiency syndrome, which is the syndrome that develops if we stayed without treatment, if we have the HIV infection and we stayed without treatment and our T cells, the CD4 cells, get below a certain threshold, so we start having the opportunistic infections and we develop this syndrome.
Okay, so as for diagnosis and early intervention, how is HIV diagnosed and why is early testing important?
Okay, so HIV is diagnosed through blood tests. We can test the antibodies against the virus, and we can test the virus itself through PCR. It's very important to early detect HIV in order to start early the antiretroviral therapy and not to develop later on into AIDS.
And what are the first steps someone should take after being diagnosed with HIV?
If someone is being diagnosed with HIV, he must immediately seek medical advice and a healthcare provider in order to be started as soon as possible on antiretroviral therapy.
And do you think they should inform anyone?
Yes, definitely. If someone is being diagnosed with HIV, he must inform his partner because HIV is transmitted through sexual relationship, and they must know this information in order to have protected sexual activities.
Okay. What is antiretroviral therapy, ART for short, and how does it work to manage HIV?
Okay, so antiretroviral therapy is the treatment that is used to treat HIV. It's a combination of different molecules, and each molecule has its own function in preventing the viral replication or preventing its penetration. Usually, it's a combination of different molecules in one pill and can be taken once daily.
And how can doctors and pharmacists help in providing the best care?
Okay, doctors mainly start by prescribing the antiretroviral therapy and the treatment for HIV patients. And here comes the role of the pharmacist to follow up the patient, to provide him with the advice needed on the timing of the drug, on the timing of taking the drug during the day, and if there is any interaction with other medications that the patient take, or if he developed any side effects. So the access to the pharmacist is mainly easier than the access to the physician.
And can you explain the concept of undetectable equals untransmittable?
Okay, for sure. So undetectable is that the patient remains undetectable viral load in his blood while on antiretroviral therapy. These patients have zero risk to transmit the virus to their partners through a sexual relationship. So undetectable is equal to untransmissible, but always we say that each patient has to follow up with his primary care physician for these advices.
And what is PrEP and who should consider taking it?
PrEP is the abbreviation of pre-exposure prophylaxis. It's a pill that someone can take it if he's going to be engaged in high-risk activities for transmission of HIV, either a sexual activity or sharing needles.
Okay. And what steps can individuals take to prevent the transmission of HIV?
For the people who has HIV, they must take their treatment, antiretroviral therapy, to prevent the transmission. For people who might be involved in activities that has high risk of HIV transmission, like sexual activities or sharing needles, they has to take PrEP or has to have protected sexual activity, or because of the sharing needles, they can exchange their needles through the pharmacies under the title of the needle exchange program.
Okay, what message would you give to someone living with HIV or someone looking to support a loved one with this condition?
HIV is a virus that infects our bodies, and the people who has HIV can take their treatment and live normally. They can live their life in normal situation. For people who surrounds people who are living with HIV, those patients or those infected people need your love and your care, and they can live without any problem.